Welcome to the video huddle for Tuesday, March 31st, 2020. We received new PPE guidance from Infection Prevention for COVID positive units this morning. All team members should wear a surgical mask at all times when on the cohort units to prevent facial touching and cross-transmission of COVID-19. All pharmacists and technicians entering 8 MCE and 8 T3 will be required to wear a face mask during the time on the unit. When the mask is removed, please place it in a paper bag with your name on the outside for use when you re-enter the unit. Please perform hand hygiene immediately after removing your mask. The mask can be reused when you return to the unit unless it is wet, soiled, or damaged. Please also see the MyVUMC news article on guidance on masking in clinical areas. Masking is now allowed in inpatient units, ambulatory clinic spaces, and procedural areas. Surgical masks that are provided by supply chain and cloth masks are permitted. N95 masks are being reserved for high-risk procedures. Please see the article for full details. How is hand hygiene going for you? Are you foaming or gelling every time you enter a patient care unit? What about anytime you enter the pharmacy? Have you used one of the new hand sanitizer dispensers at each one of the entrances? How about wiping your workstation down multiple times a day? Please continue to work these cleaning steps into your daily work routines, as these are a primary defense against COVID-19. Thank you for keeping it clean. As a hospital community, we support each other. One important way that our department can provide impactful support to our nursing colleagues is to help cluster pharmaceutical care. Each time we streamline medication administration times or recommend a change from a twice daily to a daily drug regimen dosing, we limit nursing exposure to COVID-19 and help conserve PPE. This powerful intervention has gained a great deal of attention throughout the hospital. Therefore, to help with this effort, we're asking the following. Please, every pharmacist make clustering of care a staple of your chart review for all patients on isolation for any reason. When you make an intervention with the intent of clustering care, please use the Drug Administration Issue IVent to document. Do not use the quick action, please. We will be compiling data for review, and we need to be able to do this quickly and without Willow support. Please place one IVent per patient that you intervene on. Within the IVent, list all interventions you made. This should avoid having to place multiple IVents per patient. Aside from retiming meds, be thinking about any medication changes that can result in less administrations. This includes any patient on isolation for any reason, not just our COVID positive patients, as the main goal is to preserve PPE and decrease exposure to infectious diseases by our nursing colleagues. There are a number of new resources for backup childcare available. Please visit the Employee Only Information tab on the coronavirus website and scroll to see the options that are available to you. I realized one option that either opens or closes each of our team meetings, huddles, or stand-up meetings is kudos to fellow team members. I'm dedicating a portion of our video huddles to gratitude. Thank you to Jim Heyman and Mark Sullivan for attending multiple meetings daily, including weekends, to help bring us all the up-to-date information on the COVID-19 response. Kudos to the resident pharmacists for supporting their teams and providing the best patient care possible despite the COVID pandemic. Thank you to Joanna Stallings for her care of the ICU level COVID positive patients on MICU and 8 MCE. Kudos to the residents for the patience and adaptability they exhibited when their residency presentations had to be rescheduled or moved online due to COVID-19. A big thank you to Night Shift. All of our night owls have stepped up to do whatever is asked of them. They have also voluntarily completed tasks that were not asked of them. They are pushing through their own uneasiness and providing excellent care to our patients overnight. Thank you. Thank you to Megan Janes, Linda McLaughlin, Andrew McCrae for their assistance in developing our COVID-19 code response plan. Thank you to Pratish Patel for his work with the Infectious Disease Work Group on COVID-19 pharmacotherapeutics. If you have kudos that you would like to pass on to your colleagues or to your leaders, please email me and I will include those kudos in future video huddles. This concludes the video huddle for Tuesday, March 31st, 2020. Thank you for all you do to support our patients and continue to stay safe. Thank you.